Imagine you finally found a therapist for your child with OCD, and you're so thrilled, and you start to notice that they're getting worse, not better. And you think, how can this be? I finally got them therapy, but you got them the wrong therapy. You didn't know that just finding any therapist or a therapist that says they treat anxiety isn't going to cover it. And not only will it not cover it, it might make it worse. We're going to talk all about it. That's what's up next. Hi, my name is Natasha Daniels, and I'm a therapist. If you're new to my channel, I help parents who are raising kids with anxiety and OCD, and I have a couple of them myself, so I do get this. And there's nothing worse than when I hear parents in my AT parenting community tell me that they have seen multiple therapists to watch their child get worse and worse and worse until they learn from my resources or from somebody else that they need to find a very specific type of therapist, an OCD therapist with a very specific approach. For some of you, you only have one shot at this. Your child's foot might be firmly on the brake. And if you don't find that right therapist, that door might shut permanently and you will not be able to get your child back into therapy. In fact, I've seen that happen a lot to the parents in my AT parenting community where their child is refusing to go to therapy because they had seen multiple therapists who did the wrong approach. So what is the wrong approach? Anxiety therapy is very different than OCD therapy. In fact, OCD therapy requires a very specific approach. It requires exposure response prevention, ERP, which is a type of cognitive behavioral therapy. When you are going to a general therapist, a lot of them will do cognitive behavioral therapy, CBT. So if they treat anxiety, a lot of them might think, I can treat OCD as well. And they don't have the understanding or the knowledge that OCD needs to be treated differently. And so they might feel like they're helping your child. They might feel like they're doing the right thing. In fact, a lot of therapists do this. They see kids with OCD and they do CBT with the child who has OCD. We'll talk about what that looks like in a second. But when you're doing OCD therapy, you're doing exposure response prevention, ERP. That is the first line approach to OCD. And when you're doing ERP, you have to have extra training as a therapist that most therapists do not get in graduate school, which I know that is super scary. OCD, I often say, is the stepchild of the mental health world. And I wish that wasn't so, but that's the reality. That if parents don't know what they're looking for, they're going to get into the wrong hands pretty easily because the majority of therapists out there do not know how to treat OCD. So scary. So let's talk about how this can happen. If you take a therapist, and for me, a red flag is if you're looking at a profile of a therapist and they list all the things they can treat. And you're like, I can treat ADHD and depression and autism and anxiety and OCD and grief and drug abuse and divorce and death and adults and geriatrics and couples and marriage therapy. That's a red flag right there because I want someone specific. I don't want to go to a general practitioner if my child needs a cardiologist. I'm not going to go to an endocrinologist if my child needs to see a neurologist. That doesn't make sense, right? So why would I bring my child to a mental health provider who can treat literally everything under the sun when I need a specialist? OCD is one of the most debilitating disorders, and it's important to nip it in the bud. So even if it feels like it's not that big of a deal right now, it can grow very fast, very quickly. I have seen people who are fine on Monday and are debilitated on Sunday. That's how fast it can happen. But with the right kind of treatment and the right kind of help, progress can happen just as quickly for a lot of people. And so getting them into the right hands is really critical. So let me give you some examples of what a therapist who's not trained in OCD might do in therapy that would not be helpful. Now, OCD is vastly different depending on the person. So there are many different themes and looks for OCD. And so people's intrusive thoughts are vastly different depending on what their theme is. So we'll use a couple of different examples. Let's take contamination OCD. Let's say somebody has intrusive thoughts that everything is dirty and there's germs everywhere, like the real classic stereotype of OCD. You go with an anxiety therapist and they might talk to you about, let's talk about germs, right? And they might say things like, germs are actually really good for you and there's germs everywhere. And when you wash your hands, you're really clean. And so you only have to wash your hands once. And let's talk about, why do you think your hands are still dirty? Let's explore that. Have there things happen in your childhood that make you feel like you're dirty? Have you ever had a time where your hands were dirty and you really felt like you couldn't get them clean? What kind of things do you think are dirty? So I'm approaching this in a very rational, cognitive behavioral therapy sort of way. Some therapists who are worse I have seen will say things like this: if you're really concerned about your hands being dirty, then maybe you can just wear gloves, or you can get a tissue and just hold the tissue when you have to open the doors or when you have to turn on the faucet. That way your hands don't get dirty. Or you can bring hand sanitizer. I've even seen necklaces with hand sanitizer, and you can just wear them, and you can, just hand sanitize every time you feel like your hands are dirty. Now that would be an extremely bad therapist. Even a therapist not educated in OCD isn't normally that bad that they're actually telling them to do compulsions. But I wish this wasn't true, but I have heard real stories about therapists telling people that. So at the least, they might rationalize and try to talk about intellectually why their hands are not dirty. At the worst, they might actually tell them to do compulsions like wear gloves, hand sanitize, or use tissues, which are big no-nos in the OCD world. Another theme, moral OCD. Now, I might be getting into the world where you're like, what is moral OCD? I don't even know what that is. Moral OCD is the intrusive thought that I might be a bad person, I might turn into a bad person, or I might have done bad things. It's actually a very common OCD theme that a regular therapist would not know. This is the other big issue, is that when you are with the wrong therapist, a therapist who's not trained in OCD, they will only know the surface of OCD. So they may tell you that your child doesn't have OCD, or they may not see OCD when it's there, because a lot of therapists that are not specializing in OCD only know the real stereotypical compulsions like hand washing or being afraid of germs. But that is only one little theme in a huge menu of themes and flavors of OCD. And so let's take moral OCD. If you're seeing a therapist who's not trained in OCD, they might really take fear of being a bad person at face value. So it might go like this: why do you think that you're a bad person? So you said yesterday that you had this intrusive thought, or you had this upsetting thought that you might have said that your mom was fat. Do you think your mom is fat? No. All right. So you had the thought that your mom is fat, and you told her that you thought she might be fat. Next time you have that thought, do you think maybe you need to apologize to her and say that you're sorry? And I know that yesterday you said that you think you cheated on your Spanish test. And I wonder if you should go to your Spanish teacher and talk to her about honesty and about how you did cheat, and that you need to let her know that you cheated. And maybe we need to talk to your parents about what's going on with your decisions about cheating and calling people names, and these things that are going on with you. All right, that could be how a session will go when a therapist doesn't realize that you're dealing with moral OCD. How would it go with an OCD therapist? Something like this. So you've talked a lot about a lot of your intrusive thoughts, that you have intrusive thoughts about people, being fat, even though you don't think that they're fat, or feeling like you want to say a bad word, even though you don't want to say the bad word. And you've even talked about thinking that you cheated on your Spanish test, but when we talked about it, you don't have any memory of actually cheating. You just think that maybe you did and you don't remember it. And I want to talk to you about an OCD theme that's very common around this, and it's called moral OCD. And you're not alone. That's the beginning part of what an OCD therapist would do. They're going to first educate them on just what that is, and to normalize and validate that. And so it's very important to get the right kind of therapist, because with the OCD therapist, they're going to move into ERP, exposure response prevention. They're not going to rationalize. They're not going to problem solve. They're not going to try to find the origin of the struggle. Why do you think you're a bad person? Why? Because you have a glitch in your brain because you have OCD, which is very physiological. There's no why to it. Good people have moral OCD. There's no why underneath it. A therapist not trained in OCD is going to look for the why. Was there abuse? Do you think you're a bad person in real life? Did something happen? No, you have OCD, and it's a very common OCD theme. So understanding that is really important. And then exposure response prevention will systematically help you resist the compulsions, delay them, ignore them, and then purposely trigger those intrusive thoughts on a very small scale in small increments to learn how to sit with the discomfort without doing the compulsion. It's technical and it's skill-based. And this therapist over here who hasn't had the training will have no clue what that is, how to do it, or even how to spot OCD to begin with. Where does the burden fall? On us as parents. You have to know how to spot a good therapist. You have to know how to find an OCD therapist. You have to know that ERP is the type of therapy that you're looking for. You have to know that someone who says they do CBT or neurofeedback or play therapy or art therapy or EMDR is not what you're looking for OCD. The frontline treatment, the evidence-based treatment for OCD is ERP. And if a therapist is trying to tell you that they do all these other things and they've never heard of ERP, then you got to get your running shoes on, because you have to educate yourself. And I do have support for you. I have a course, How to Help Our Kids with OCD because you have to know enough to spot somebody who doesn't. You can check it out at atparentingsurvivalschool.com, and I will leave a link in the comments below, and I'll pin it to the top so that you can get the support, you can get the education, because no matter what, whether you have a therapist or not, you're gonna have to do the work at home, create a therapeutic home environment so that you can help your kids and spot a good therapist from a bad therapist. I will see you next week. Don't forget to find the sparkle in everything you do. Take care.